So thank you for joining us today. I've wanted to have this conversation for quite some time now. Ultimate Vitality has been working with KPAX since at least 2011, and Dr. John Kaiser, who's joining me today, is somebody that I really admire. So for those of you that don't know my story, I just celebrated this August 10 years cancer-free. I was diagnosed in March of 2009 with stage 3 breast cancer. I was actually the first person in my family to have breast cancer, but some of the doctors at University of California, Davis thought it was very strange that I was only 41 years old and had advanced cancer. I had stage 3, I had positive lymph nodes. And so a really bright doctor there recommended that I do the genetic testing, the BRCA test, which is very, very widely available now, but was kind of cutting edge at that time. And it actually turned out that I was positive for the BRCA2 gene. So I'll be forever grateful for them, because actually 2 of my sisters have also tested positive for the gene, and they were able to avoid actually going through chemotherapy and radiation and 10 plus surgeries that I've gone through by choosing to do a double mastectomy and prophylactic removal of their ovaries, which is the standard of care if you are over the age of 40 and you have the BRCA gene, if you talk to a geneticist. So one of the products that I used, and people always ask me, what do I take? How am I doing so well? First, I'm a naturopathic nutritionist. Nothing I say, I do not treat or diagnose disease. I am not a physician. Dr. Kaiser, who's joining me, is in fact a physician, but I do share on social media and other places what I've done. But it is in no way a diagnosis. It's just a recommendation of what I do when people ask me. But I always encourage people to check with their own doctor or their own physician. And I tend not to work with people who currently rather people who have completed their treatment and are trying to regain some health and wellness after their treatment. Ultimate Vitality was started about 10 years ago. After I had my diagnosis, I was taking a lot of supplements, and as I said, a lot of people wanted to know what I was doing, and I wanted to reach a broader audience and help them as well. So we're going to talk a little bit about one of the things that I take every day, which is KPAX immune formulation. And I'm super lucky to have the person who created KPAX with me today. And he is extremely knowledgeable in this space, and it's something we're both really passionate about. So I would like to welcome Dr. Kaiser, the CEO and medical person who developed KPAX.
Hi, Leslie. Nice to be here.
Hi. I'm glad to have you. If you would please share with our audience a little bit about your background before we kind of jump into it.
Yeah, so when I started my medical practice 30 years ago here in San Francisco, that's where I'm based, I was quickly attracted and treating lots of people with serious medical conditions like HIV/AIDS and cancer and other immune system disorders. And even way back in medical school, I was really frustrated with only the standard drug approach, drug, surgery, and chemotherapy to treating disease. And so I went out and on my own got trained in nutrition and naturopathy and the use of vitamin supplements and herbs and other natural therapies. And I practice what's called integrative or functional medicine, which is where you take the best of both natural and standard medical therapies, and you put together an individualized program that best suits the needs of your patient. And, you know, there are so many things, as you well know, that a person can do naturally to support the health of their bodies, to support their immune system, to support the liver detox, to help their nervous system stay strong. And so, you know, it's really important that at the same time you're treating a disease aggressively with conventional medicine, that you support the body in as many ways as possible. And one thing that specifically pertains to people who are dealing with cancer is I look at cancer as an immune system issue, because once a person gets treated for cancer, the most important thing is to keep their immune system strong, because your oncologist says, okay, I'll see you back in 6 months. We'll do a CAT scan, I'll examine you, but it's your immune system that is left to protect you from a cancer recurrence. And so I developed the KPAX immune support formula based on my experience back in the early days treating AIDS, which is one of the most severe immune system problems. I developed the KPAX formula to have all the micronutrients that are necessary to support a strong immune system and to make that the foundation multivitamin of your program.
Thanks. And I'm a believer and a taker. So I definitely love the product. And I actually jokingly say to people that if I accidentally run out, which owning a supplement company, I never should run out, but it has happened. And I start to get a little frightened because I keep telling everyone I really think the secret to my lack of recurrence is in part KPAX Immune. I mean, certainly I practice a very clean diet and other things. So talk to me about why specifically you feel that this really helps with cancer and what made you specifically decide to get into the cancer space, because in addition to having the KPAX Immune, Dr. Kaiser also put together an After Cancer Pack, and what's really significant about that is it's really putting together key elements that are going to specifically address the kind of collateral damage, as I refer to it, that you undergo as a result of chemotherapy, no matter what kind of chemotherapy you're having, and radiation. And so talk to me a little bit about more about that, please.
Yes. So, well, first of all, the reason I started the company KPAX Pharmaceuticals was because I was taking care of hundreds of patients with these serious medical problems, and I had very specific nutrient formulas that I wanted them to take. And there's so many reports about consumer grade nutritional supplements that either have very little of what they say on the label, or they have twice as much of what they say on the label. And, there's not very standardized quality control. And so one of the reasons I started KPAX was to make sure that the exact formulas I wanted my patients to take were made to pharmaceutical grade quality, using the highest quality raw materials, the best manufacturing processes, and just really that they'd be getting exactly what, if they trusted me to recommend these, prescribe these formulas, that they'd be getting exactly what I was recommending. So KPAX has also performed 4 clinical trials using these formulas in people with AIDS and fatigue and brain fog, and shown very positive results. So that was why I started the company. But the way these products work, you got to really go down to a deep level on what's going on in all the cells of your body when you're dealing with something like cancer, especially if you've been treated with chemotherapy or radiation. And as you mentioned, those treatments, whereas they're directed primarily at eliminating cancer cells, they cause enormous collateral damage. They have damage to the gut, there's damage to the immune system cells, and damage to the nervous system. And on a fundamental level, one of the parts of the cells that become damaged are called the mitochondria. And you're going to be hearing more and more about the role of the mitochondria in making energy for your cells and keeping your cells healthy. And that's the part of the cell that chemotherapy damages. It's the mitochondria. And the mitochondria, as I mentioned, make all the energy for your cells. So if the mitochondria are damaged, your immune cells, your liver cells, and your brain cells don't have the surplus of energy they need to keep you as healthy as possible. And so KPAX Immune Formula and the KPAX Energy Support Formula, which are part of the after chemo pack work on the mitochondria to help your cells make a lot of healthy energy and be able to do their job. Also in the after chemo pack are support for the gut in the form of a probiotic supplement and support of the liver in a supplement called curcumin. Curcumin is a liver detoxification nutrient or herb, and it also is anti-inflammatory. And so when I created the after chemo pack, these are the 4 nutritional formulas that I recommend to my patients after they finish their cancer treatment to support the immune system, the liver, and the nervous system. And we've put it all together into a convenient package at a greatly discounted price. And it's meant to take the guesswork away. You don't have to go see another doctor to say, what are the most important nutrient formulas for me to take to keep myself healthy moving forward?
Excellent. So I do still take curcumin as an anti-inflammatory because I still deal with some of the, even ongoing 10 years later, some of the cumulative effects of my treatment because I was on an aromatase inhibitor for 9 years. And it's had a lot of damage to my joints. I have some early osteoarthritis, so I definitely use curcumin products to help with some of that inflammation. I take the KPAX Energy. I'm off and on with my probiotics, but I think we'll probably talk a little bit more about mitochondria. I don't know if there's anybody as passionate as you and I am. Maybe they're out there. I just haven't encountered them yet about mitochondria. I am a big fan for the people that follow me on social media a lot. I do a lot of fasting, not just intermittent fasting, but longer term fasting. Again, not something you should necessarily embark on without checking with your physician, especially if you're a diabetic. So again, I hope people are just taking what I'm saying as what I'm doing and not taking it as a suggestion. But I do think long-term fasting, it's my belief that your mitochondria get fatigued because they spend, and you can tell me your thoughts, but 80% of their time spent on digestion and elimination of the food you eat. And so when you do a longer term fast, you give those mitochondria a break and they can start doing some really great repair work on your system if you're a healthy individual. And I don't recommend fasting for people who are in a current disease state.
Yeah, well, I think, what you're talking about is helping your gut to be as healthy as possible. And, there's billions of microorganisms in your gut, a whole community. It's your inner garden. And specifically with regard to fasting, when you eat a meal, your whole body focuses on digesting the meal, and your blood flow goes to your gut and your liver goes into a certain type of digestion mode. Insulin is released, and it's really important that you let your gut digest what you have eaten and then go into a different mode where it uses that energy to help you in your activities, help your brain work, help you go out and about and do, whatever you're doing during the day. And your gut needs to rest for at least several hours in between meals. And when your gut's resting, it can rebuild itself, it can stay healthy. So whether you're just fasting, for 4 to 6 hours in between meals, or whether you're, doing a juice fast for a day or two, it's really important not to just be eating all the time and snacking and never giving your gut the opportunity to rest. And so, giving your gut probiotics is a good way to help things along. But your diet is the most important component of gut health. And I just want to let you know that I recently released an ebook for people who have fatigue, and it talks about diet and supplements and hormones and mind-body techniques. And if anybody wants to go to my private practice website, which is johnkaiser.com, you can download a free copy of this ebook on a healing program for fatigue, which goes into a lot of detail on the dietary techniques I recommend.
So that's a great segue into talking about your other key product that so a lot of people contact me again through social media. I have a really significant following of cancer survivors, and I was always surprised that I have both males and females, not just breast cancer survivors, but all kinds of different types of cancer. So that was really encouraging that I'm reaching such a broad audience. And one of the number one questions I get from people who maybe are not currently in treatment or just finished treatment, which obviously when I encounter those people, I recommend the after chemo pack once they've completed treatment. But really, even years after they've completed treatment, people who had cancer really suffer a lot with a lack of energy. And so let's talk a little about why you created KPAX Energy. And certainly it has other applications other than just helping people. I know you do a lot of work with chronic fatigue, and I definitely would like to touch on that as well. But definitely let's talk about helping people recover their energy after they've completed treatment, because that's something that lingers really quite a long time. I mean, people who are even 5 or 7 years out tell me they really have a problem, recovering from brain fog and fatigue.
Right. So other than gastrointestinal symptoms like nausea or diarrhea, fatigue and brain fog, which was also referred to as chemo brain, these are the two of the most common and problematic symptoms of cancer patients. Patients who are going through treatment, or even more importantly, who have completed treatment. As you mentioned, the fatigue and the brain fog symptoms can last for years. And standard medicine has virtually no treatments for these patients. Maybe they'll offer you an antidepressant, which is not the right way to treat. You don't have an antidepressant deficiency. That's not the reason that you have fatigue or brain fog. It's because the mitochondria of your nervous system have been damaged by the treatment and need to be supported and rebuilt. Their health needs to be rebuilt. And so, whereas the immune product is the basic mitochondrial formula, which can act as your daily multivitamin, the energy product, KPAX Energy, takes that formula and adds a very, very almost homeopathic dosage of pharmaceutical grade caffeine, far less than a single cup of coffee. But what it does is it acts like a catalyst to get those nutrients working even better in the nervous system. And people who take KPAX Energy describe having a real swell of energy that's healthy, that feels good, that lasts 4 or 5 hours with no jitteriness, no anxiety, and no crash when it's done, because that little bit of caffeine is given with such a good complement of nutrients for the brain. And so we call the combination the KPAX Energy Support Program, where you take a couple of immune and one energy with breakfast, and a couple of immune and one energy with lunch. And this can virtually eliminate chronic fatigue and chemo brain symptoms, as well as continuing to support your healing, your long-term healing, and the strength of your immune system. So for people who have those symptoms, fatigue or brain fog symptoms, you can feel better in as little as a week or two on the KPAX Energy Support Program, and I'm glad that you have put a graphic up there, and people can see that when you combine these two and you follow those very easy directions, this provides one of the best foundations for your long-term health moving forward, at the same time as it helps rebuild the healthier mitochondria.
And that's the feedback I've gotten where I've recommended that program to people who say, what can I do? Because it is true. I'm very grateful to the oncologist who saved my life. But once you finish your last treatment, they kind of ring the bell and you're off on your own. And so I think a lot of people who have had cancer struggle with I fought to save my life. I put myself through all of this stuff, and now I'm just a shell of my former self. And, trying to pave that way back to finding the pieces of yourself. I mean, some of which you may never get back, depending on how extreme your cancer diagnosis was. But, definitely don't want to be left with that feeling of, I did all these things to save my life, and I want to reclaim the life I fought to save. And I have no problem telling people that I think your products are half the reason I feel that I've returned a lot to myself, and why I like promoting them as much as I do, because I think you have amazing products. I think you really have such a commitment to this space, and not just this space, but you've done some really amazing work with chronic fatigue syndrome and fibromyalgia. So I think as more and more people are adopting integrative and functional medicine, more and more people who have kind of autoimmune or conditions that traditional Western medicine doesn't really have a solution for, or is hard pressed to diagnose, you bring something that's very much needed in the space. So.
Yeah, and I appreciate all of what you just said, and all of what you've accomplished. You're a living example of how somebody can use a diagnosis and an experience of going through being diagnosed with cancer almost is a wake-up call to realize that you need to make some changes, adjustments to your lifestyle, maybe to your stress level, to your nutrition, and you can end up being healthier and living longer, not in spite of cancer, but almost because of it, because you made all these changes. And if I could just make a few key points, it's really important for people to understand, we're not talking about using this as a treatment for cancer. We strongly advocate that you see an oncologist, that you get the best medical care has to offer, that you follow the recommendations of your doctor and your specialist. But what this program does, what these products can do, is fill a missing piece in what conventional medicine has or doesn't have to offer. And that is, in addition to aiming at the cancer cells, we need to support the health of our bodies, of our immune systems, and of our liver and our nervous system. So yes, we want you to see your oncologist on a regular basis, get your follow-up care. But when it comes to diet and nutrition and supporting the health of your body naturally, focusing on the health of your mitochondria and your immune system, in my opinion and my experience, is critically important to ensuring that you don't get a recurrence and that you live a long, healthy, normal life.
Anything else that you would like? We're getting close to the end of our time here. Anything else that you would like to share today? I know you're doing a lot of work in a lot of different areas. Anything that you think would be valuable? And certainly we can plan another session another time and cover maybe some different information for people. I'm still working on trying to find a cartoonist who can make some really cool graphics about what mitochondria do in your body in a user-friendly way that will, explain science, but in a really fun way. And so I'd love to collaborate with you on that. But if there's anything else you'd like to talk about that you're doing before we wrap up, I'd love to hear what's new on the horizon over at KPAX.
Yeah, so the bottom line is this is all about energy, right? If your cells do not cannot make a sufficient amount of energy because their mitochondria are weak or damaged, then your brain's not going to function as well as it could, your immune system's not going to function as well as it could, and your liver's not going to function as well as it could. And those three systems are very energy intensive. They use a lot of your energy. So if you get your cells with the proper support, making a surplus of healthy energy, everything works better. And that's been my focus since I made this breakthrough early on in identifying how to support mitochondrial function. And I think we just need to continue doing research studies. So I've already published 4 research studies on the use of this concept, and we need to continue doing research studies to identify how this type of approach can be integrated into a holistic program. And it's really about putting all the pieces in place. You know, there's a diet piece, there's a vitamin supplement piece, stress reduction, and standard medications. And like I said, if anybody wants to learn more about what I do in my individual practice with patients, johnkaiser.com, and there's no H in the John, just Jon. It goes through some more detail, but I really want to thank you for being such a great advocate on behalf of cancer survivors, and you're such a great example of the way to to move forward in a very healthy way and to thrive even more than just survive. So I want to tip my hat to you and thank you for all that you're doing.
Well, I also would like to thank you for joining me today and sharing your vast knowledge and for creating products that have given me back pieces of myself. So I'm not sure I would be sitting here with the same energy and the same great, feelings had I not used your products. And that's sincere. That's not a sales pitch. I really do take the products. I really do believe whether it's, of course I believe it's true, but even if suspicious or something, I'm so convinced right now that I do not like to be without it, because my odds at being here 10 years was very small with my diagnosis. So every day is a gift. And if anybody watching today or who watches this video, we will be using a code on ultimatevitality.com for 10% off all KPAX products, and that code is UV10. And I appreciate everyone who's listened today, and hopefully we can find an opportunity to find something else to talk about in the future.
I look forward to it. So thank you very much. And I want to thank everybody who tuned in. And, these are products that are designed to help you feel better in a noticeable way. So if you try them, after a month or maybe 2, that's the goal, is that you actually notice feeling better. And that's the best sign that they're working.
Thanks, everybody.